Welcome to Dental Sleep in 5, Episode 13. Oral appliance therapy versus CPAP. Which is better? Disclosure: no vested interest in any appliance, device, or technology. Maintain a sleep disorders dentistry practice, conduct research, and provide educational programs. Our facility is accredited by the AADSM, and our facility and all programs follow AADSM guidelines. Oral appliance therapy versus CPAP. Which is better? Well, CPAP is gold standard therapy for OSA. So the obvious answer is CPAP, right? Hell no. The answer is not so obvious. The truth is, it depends on one critical factor. So keep watching. To start, let's admit up front that CPAP is better at reducing AHI than oral appliance therapy, and thus it's considered gold standard therapy. However, objective measures of health outcomes are similar across many variables. In addition, functional outcomes are also similar across many variables. Blood pressure outcomes are similar. Cardiovascular mortality is similar. How does one explain this? More effective, but similar outcomes. Well, there seems to be a dose-response relationship observed between CPAP use and the range of subjective and objective outcomes. We look at cerebrovascular events, development of hypertension, sleepiness. It's all related. The level of help is related directly to how long the patient uses CPAP. Patients using CPAP less than 4 hours per night are 5.1 times more likely to develop severe hypertension. Treatment compliance tells a different story. It favors oral appliance therapy heavily. Even with strategies to enhance patient acceptance and usage for CPAP, only about 50% of patients use their CPAP greater than 4 hours after 6 months. PAP therapy is abandoned more often than oral appliance therapy, and both patients and bed partners prefer oral appliance therapy to PAP. Over a number of variables, oral appliances are preferred right across the board, and they scored at 80% favoring oral appliance, 20% favoring CPAP across variables on an average. Considering the impact of compliance on health outcomes, a realistic comparison of CPAP versus oral appliance therapy must include compliance. A realistic comparison of CPAP versus oral appliance therapy is easy to do using a software package that Somnodent created for us called the effectiveness equation. It allows us to input baseline AHI, the impact CPAP has, the impact an oral appliance has. We can also input how long the patient used their PAP and how long they used their oral appliance. And it'll do the math and tell us exactly how these two different therapies compared in reality, taking into consideration compliance. But let's look at it first the way it's most often looked at. Baseline AHI of 99. CPAP brings it down to 3.9. Effective management of sleep apnea through CPAP. To be expected, gold standard therapy, it works. Oral appliance, let's see if it works. Brings the patient down to 27.9. This is a terrible failure by most people's standards, by everyone's standards. However, The factor that is usually not taken into consideration is the fact that the patient wears their CPAP 5.5 hours per night versus their oral appliance 7.5 hours per night. Now, even so, any sleep physician would be content with 5.5 hours per night, meeting the minimum expectation of 4 hours. But when you do the math, the global number of events for sleep apnea, 268 for CPAP, 258 for the oral appliance. Well, measured this way, the oral appliance isn't doing too badly. And I think this goes a long way in explaining how oral appliances can end up with a very similar health outcome and benefit to the patient in spite of the fact that it doesn't bring the AHI down to below 5 as often as CPAP. Of course, we shouldn't use this as an excuse to settle for a high AHI. Look into the possibility of further adjustment, perhaps altering the vertical, using adjunctive therapies that combine PAP and oral appliance, or positional therapy, or weight loss surgery, muscle training. A number of other adjunctive therapies are available to help improve our game and get that AHI down as much as possible. So CPAP versus oral appliance, which is better? Well, the answer depends on your optics. If you're looking at AHI resolution, CPAP wins. If you're looking at patient preference, oral appliance therapy dominates. If you're looking at disease alleviation, it's simply a tie. The literature suggests this question can only be answered if also considering adherence to therapy, or how long the patient wears the device. Most important factor, you've been waiting for this. Will the patient wear it? It's really as simple as that. Thank you and sweet dreams.